pathogen is no longer active, but the ELI spot then comes along and says, okay, wait a minute. We have immune activation of this and we're trying to deal with it, or we're not. And so when we look at early infection, you may have that IgM. Anybody that has an IgM sort of response, I mean, you probably need to take that, seriously in regards to possible acute infection. But then if you look at that interferon gamma, and there's T cell activation of this, and it may occur. This is what's interesting. You may have the interferon response and the T cell activation before the detectable antibody production actually happens in this. Okay, IgG testing a lot of times, or Ig testing in general, whether it be G or M, sometimes you may not be able to amplify or augment the response. So the T cell response will tell you a little bit earlier in some of these things. And then is there immune suppression? So we're going through phases here: past infection, early infection, immune suppression. So sometimes people have low immunoglobulin responses. They're just not getting a good immunoglobulin response. So people think, oh, there's really not a problem going on. So they don't mount an antibody response, but it's still detectable in the ELI spot test. So that's kind of what's important here. It's still present in the ELI spot test. So you may say, oh, wow, man, the immunoglobulins are either there or not there. Sometimes it's a little bit misleading, but the ELI spot test actually is going to give you a little bit more information to that. Now, the other thing that happens with immunoglobulins is as the immune system is reacting to one particular pathogen, it can undergo epitopes, or it can actually have clonal expansion. So you may be reacting to one thing, but then it shows cross-reactive activation to another thing. So it loses some specificity sometimes. And so you may get some abnormal positives of that. So some of these antibodies, they're not specific to the pathogen. However, when we start looking more at the ELI spot test, it will be appropriate for that response. Okay, so you don't get that cross-reactivity. So a good example would be some people that react to gluten per se. Well, they may have a reaction to the food gluten, but then they're going to get a cross reaction to thyroid where their TPO antibodies will go up. And sometimes TPO antibodies will change in thyroid as a result of Epstein-Barr virus. So you don't always know the specificity, but an ELI spot for Epstein-Barr will be very specific for Epstein-Barr, and you won't have to worry about clonal expansion and getting some sort of abnormal cross-reactive response.